A sobering report from the Centers for Disease Control says this: chronic diseases are the leading causes of death and disability in the U.S. Currently, 45% of Americans have a chronic disease, such as heart disease, diabetes, and asthma. And the patients that we're talking about are not older people. Chiropractor Dr. Dane Donahue is back with us talking health and some really significant results from his 8 weeks to wellness plan. You talk about healthfulness. What are we talking about when you say healthfulness?
Well, healthfulness, longevity means how long we live, Pat. Healthfulness is how well do we live. So in America, we live a relatively short period of time till we start to develop chronic disease, as you said, asthma, allergies, diabetes, heart disease, Parkinson's, Alzheimer's. I could keep going on and on. But these diseases are largely preventable with lifestyle modification.
And so how do we begin that? How do we improve our healthfulness?
Well, first of all, there was a great study that was done. It was done in the Archives of Internal Medicine. It was called the EPIC study. It was a huge study done on 23,000 people. And they looked at 4 behaviors, Pat. They looked at people who keep their BMI under 30, which is just not being obese, not smoking, eating a healthy diet, and exercising 3.5 hours a week. The people that followed those 4 behaviors had incredible results. They were able to eliminate most heart attacks, 93% of diabetes was prevented, I think 50% of stroke was prevented, and 36% of all cancers were prevented. It's a phenomenal study.
Yeah, it really is, and it seems like it's really fairly simple and something that really could be within our control. You talk about the triune of health. Explain that. I think that's an interesting concept.
So the triune health is this. We all are good in probably one area. We're good with our diet. We're good with exercise. Some people are really mellow and they use their mind very well. But to be healthy, we really need that triangle. And a triangle is equilateral parts, right? It's 3 parts. It's how are we moving, how are we thinking, and how are we eating. And we've heard of the concept of you are what you eat, but how about you are how you move? You are what you think about. So those 3 things are really important to keep it simple. How are you moving? Exercise, how are you eating, and then how are you using your mind and thinking and managing stress?
And so you talk about eight weeks to wellness, and you had one of your patients, her name is Sandy. We have a before picture of her, and she actually went through your program. And so tell us, she had real numbers improvement.
Yeah, you know, the thing that we see in our program is decreased cholesterol, decreased body fat. People are moving better, they're thinking better, they're happier people. And if you could create all of that in a pill, you know, be able to do all that in one pill, we wouldn't be able to sell enough. And yet we can do this with lifestyle modification and really just taking responsibility for our health. Pat, it's really what it's all about. But, you know, again, common sense is in common practice. So we need a doctor, we need somebody in our lives to hold us accountable to do the things that we know we should be doing.
Exactly.
Yeah.
Okay, and Sandy actually had real improvement in her cholesterol and a whole series of other real numbers. Dr. D, always a pleasure to have you with us. 8 weeks, and that's all it takes, right?
Just go to 8ww.com. It's where people can learn more information about the program.
Terrific. 8 weeks to wellness. Thanks so much. For more information on 8 weeks to wellness and Dr. Dane Donahue and his team, you can head to cbsphilly.com and click on the Talk Philly. When we come back, we have Carol's forecast.